Another measurement scale, PPS. We've already reviewed the frailty scale, the FAST scale. Let's move on to PPS, or palliative performance scale. This is actually similar to the frailty scale in that it looks at patients functionally regarding their ambulation, activity level, self-care, intake, level of consciousness. Each level of function ranges from being fully independent to being completely dependent and needing 24-hour care. For instance, a PPS of 100 is a person who is fully independent and safe in ambulation. At 40%, the person is mostly in bed, and at 10%, the lowest, they are fully bedbound. The second category is activity. At 100%, the patient can perform any normal activity they desire. At 40%, they are unable to do almost any activity due to extensive disease. And at 30% and below, no activities can be performed. Regarding the self-care level of function, as before, 100%, person is allowed to be living fully independently, taking care of themselves, and at 40%, they are needing consistent assistance. They need to be bathed, need help with dressing, but they still may be able to feed themselves. At 30% and under, they require total and full 24-hour care. Moving on to intake, as you imagine, at 100%, they can eat whatever they want, but by declining to 30%, they have reduced intake, and by 20%, they're only taking sips and bites, and at 10%, they're only receiving sublingual meds and oral care for comfort. The last category of evaluation is the LOC, or level of cognition. Remember the FAST? You may be evaluating the patient with this scale if they have Alzheimer's or dementia diagnosis. In the PPS scale, we range from 100% being fully functional with a normal level of consciousness. We move through decline to drowsy, confused, and often to the very bottom of full comatose. Just to reiterate, there are different scales to measure patient decline. And notice, you can use several of these scales fully to evaluate a patient for admission or recertification. Click on our link below for our digital version of the Hospice Care Plan. Get it? Watch all of our videos to learn how to care for your patient or loved one. And always remember our motto at the Hospice Care Plan: care is treatment.